Hi, my name is Marina Forster, and I am going to present to you my interviewee, Barbara Schnurr, who was a nurse for over 50 years and really got to travel all over the United States and all over the world to practice medicine. So my interviewee, Barbara, became a nurse because her family had a line of doctors and nurses. However, her mother was her role model of a nurse. She looked up to her mother, who graduated from the University of Pennsylvania School of Nursing in 1925. Barbara wanted to do just as her mother had, which was serving people and giving to others. And because of that, Barbara decided to go to the University of Pennsylvania School of Nursing, the 3-year diploma program, and graduated in 1956. Soon after that, she went to Duke University College of Nursing and received her BSN. It was during this time that Barbara worked with the Children's Clinical Nursing Unit until 1960, where she went and worked at Texas Children's Hospital in Houston. After that, Barbara went to Queen Elizabeth's Hospital in London, England, where she worked as a staff nurse. And when she told me about her experience as a staff nurse and during her time in England, she explained to me how there was this really big distinction between each level of nurses. So there were 3 divisions of nursing, and the first was the sister, and that was the highest, and they were the registered nurses. They would be supervising, and it actually had nothing to do with religion, but they were the ones who were really overseeing most of the operations and what was going on in the hospital and things like that. And so then after that was the staff nurse, which is what Barbara was when she went to England. And they were also a registered nurse, but they would be a supervisor when the sisters weren't around. But their general role was admitting casualty patients, which was in the casualty room was like a glorified ER where there were scheduled admissions, but they also took in emergency patients. And then finally the nurse, and they were always called the nurse, which she made very clear to me, was the student nurse, so anybody studying to become a nurse. And Barbara made very clear that there were very different distinctions between all these nurses. The sisters did not interact with the staff nurses, and the staff nurses were expected not to interact with the nurses socially. So each division, each level of nursing while she was in England had had its own line of work that they needed to do, and they it was do their job and get it done, and you weren't really friends with anybody else except for your group of people. An example that Barbara gave me was a really funny one, but she lived on the floor with a sister, and it was just, when I asked her for clarification, because I thought, all these have divisions, when I asked her for clarification on that, she said that, it was just a mishap, and there weren't any more rooms on the staff nurse floor. So she was on the floor with the sisters, and a sister came over to her and told her while she was doing laundry that she couldn't put her hang her stockings up in their laundry room because she wasn't a sister, and she was just a staff nurse. And so that was one of the biggest issues Barbara had during her time as a healthcare, in the healthcare services, was really more with women than it was with men, because there were all these hierarchies in terms of nursing. But Barbara also explained to me that there wasn't this much of a hierarchy or strict divisions when she went back to the United States, and that it was really just in England that she had the most issues. And so then after she came back from England, because her boyfriend at the time called her and said, I want to get married. And, being a traveling woman, Barbara was like, the only way I'm going to marry you is if we get to travel the world. And his name was Paul. He was doing his residency at the Mayo Clinic for plastic surgery. And when he agreed to that, she decided to move back to the United States and taught at St. Mary's Hospital in Rochester, New York, while he finished up his residency. And so once he did that, they got married and they traveled the world together. He performed cleft palate operations on impoverished children, so people who didn't have access to medicine the way we do here in the United States, or were just dire situations that really needed his attention, because he became a very well-renowned plastic surgeon pretty quickly. But Barbara was able to travel all over the world and help assist her husband in all of these surgeries, which really gave a different perspective to women in the healthcare profession during that time. So, I mean, think about it. She was in 1956. That's when she graduated school. All this was happening during 60s, 70s, 80s. And still women are oppressed in the healthcare profession. However, she was given a very different experience, having a husband who was a physician and being able to travel all over the world. She was just able to have a very different perspective on how medicine is supposed to work and how roles worked within the medical field. However, when I first asked her, what kind of characteristics helped her succeed in her field, she told me that being persistent, confident, conscientious, and caring were characteristics that helped her excel at her job. I quote, "There were times when I was forced to push boundaries because it felt like things could be better. One experience I remember was that my female supervisor was cold to me because of my suggestions and work ethic. She was distant toward me because of some suggestions I made regarding a patient's health that she didn't quite agree with. The suggestion was that I wanted to wear a color pinafore instead of the white one, because she just felt that it was sterile. So, instead of males being the oppressors like we read about with Anne Preston trying to introduce her, I mean, that was also much more in the past than Barbara was in school. But, we think about that as we go forward, and just how oppressed women were and how they were shunned mostly by men. It was interesting to see Barbara's perspective of really having dealt with more female contention and hierarchy and, oppression when it came to her medical experiences. So I thought that was pretty interesting because that differed greatly from what we had learned about in class. When I asked her what some issues she had faced, experienced, or observed, she told me that during her career there were very few female medical doctors, and it was unheard of to have a male nurse. They just simply didn't exist. And she explained to me what we already know that we learned about during our second module, the factors of influence, was that women had expectations to be a nurse, really. That was like their job. That was one of the expected jobs. But furthermore than that is that they were expected to be a mother. And that was a role that Barbara took very seriously and really cared for. She explained to me that being a mother was harder than even being a nurse, that she felt that there were more expectations, and the job of being a mother was much more taxing than it was to be a nurse. And she took a lot of pride in that. And, we look at women like Mary Grove, and we look at, Shu, and these are women who sacrificed families and marriages in order to excel in the field of medicine. No one's right or wrong, but it was just very interesting to see Barbara's perspective of this, and really wanting to care for her family and fitting in with the social norms of the time. And while, her husband was a physician and operated every day, she was expected to be at home with the kids and work as a nurse as well. So I would say that in my comparison, by and large, her experiences as a nurse were very different than those that we've learned about in general. I spoke to her about what was the most rewarding part, because, sometimes we think that the job is so hard, it's so strenuous that it can be really taxing. And we've learned that from our readings as well. But she felt that she had a very fantastic life. And I think that also goes in line with, I think anyone that we learned about would really be able to say that. You look at Anne Preston, and you look at, Gove, and all these women who have trailblazed moving forward. I don't think any of them would regret their decisions to become physicians and nurses and teachers, which is also something Barbara did and took very seriously while she was in Rochester, is teaching women pediatric care and how to become a nurse, and teaching student nurses to how to do their jobs correctly. It's all part of the evolutionary sequence that is imperative to the growth of the profession. And so it was really cool hearing about Barbara's experience as a teacher and, the expectations that were then versus now. And, she says that she felt like she had a fantastic life. She felt that she had a worthwhile career helping children enjoy their lives where they may not have been enjoyed, especially when she got to travel the world with her husband repairing cleft palates. She recalls one instance specifically where they met a 12-year-old girl who had 2 openings in her palate, which is pretty uncommon for the most part, when there's usually just one opening. And when she saw her, she just looked at her husband and said, "How are we going to fix it?" And he just sutured both sides and she was perfect. And it was little moments like that that made, the whole profession worthwhile for Barbara, was seeing how happy the families were and the mothers were and the fathers were, and especially the patients after they were able to undergo a life-changing surgery for the better. And finally, when I asked her if she had any advice for a practicing or studying or practicing nurse right now these days, since she has been retired since 2008, she said that she would tell them that it's a fabulous life and that there's a multitude of things that they can do once they are considered a nurse, and not to limit themselves when they get into the field, because as a living example, there's so many places you can go and so many places that the job can take you. I mean, where do they not need a nurse? Wherever there's a hospital, they probably need a nurse. And it's a boundless job, and you will help people every day. And she felt like it was an extremely satisfactory job, and she encourages everyone to go ahead and do it. So that was my interview with Barbara Schnurr. I felt like it was really enjoyable. I learned so much, and it was really great to get a different perspective compared to what we've learned in class. I felt like in class we dealt much more with the oppression of females in the profession and how hard it was for them to move forward. And as much as I really was, I would get angry about it all the time. But then hearing Barbara's side of things, where, she didn't entirely fall into the expectations and the norms, she still lived a life that was different than the women that we have encountered. And it was just it was good to finish this term out with getting a different perspective, that, not all women were angry about it, and that people were still able to enjoy the profession despite all of the hard comings that came with wanting to become a female physician. So that is my presentation. Thank you so much, and I hope you enjoy.